Hello, everyone, and thank you for joining us for Wake Tech's virtual open house. In this session, you will learn more about dental assisting. Before we get started, I would like our presenter, Miss Trudy Clark, to introduce herself.
Hello, I'm Trudy Clark. I'm the department head of the Dental Assisting Program. We welcome you here this evening to learn more about the Dental Assisting Program and profession.
During this presentation, feel free to submit your questions and we will do our best to answer them at the end of our session. Let's get started.
The Dental Assisting Program at Wake Technical Community College is 1 year in length, and we're going to tell you a little bit about the program. First of all, it's 3 semesters. You have a fall, spring, and summer term. It begins in August, ends in July. Students are required to take 4 Gen Ed courses that are listed here for you, and those 4 Gen Ed courses are the courses that are used for ranking and for earning points and then being ranked for the competitive admissions process. And then when you get accepted into the program, you will take 10 DEN courses. And we do have the competitive admission process, which we'll be talking a little bit more about later. We allow 32 students, or we accept 32 students per year, and the deadline date for your application is mid-May. It's a 1-year program. The most exciting thing I think about our program and what makes our program very strong is our students receive over 384 clinical contact hours to providing direct patient care under supervision. In the spring semester, January through May, our students rotate through the UNC Adams School of Dentistry, or Adams UNC School of Dentistry. They rotate through Wake County Human Services in Raleigh, North Carolina, and they rotate through Wake Smiles in Raleigh, North Carolina, and also in Chapel Hill, they rotate through the Hospital Dental Clinic. They finish up the spring semester clinicals, and then they transition into the summer term where they'll rotate through private practices all over the area, Wake County, Johnson County, Orange County, Durham County, private practices that are either specialties such as orthodontics, endodontics, oral surgery, or to general practices within the summer term rotations. And this is where they learn to be a chairside dental assistant. So the dental office is typically owned by a dentist, and the dentist employs a team, and the dental assistant is part of that team along with the dental hygienist. And sometimes they have a separate person that's up front, that's the receptionist. That could be a dental assistant, but that's the 3 kind of people that might be 2 hygienists and 4 assistants and 1 receptionist that make up this dental team. We're going to focus obviously on dental assisting, but you can have a career in dental hygiene, you can have a career as a dental lab technician, and obviously you can have a career as a dentist. Now we have a boot camp that's coming up. We're very excited about it because we were not able to hold a boot camp since last March 6th. We held our last one. Due to COVID, we were not able to hold one for the summer, fall, or spring semester. And this upcoming boot camp is on June 18th. All the information is on the website. If you go to the dental assisting website or the dental hygiene website, you'll find the information about the boot camp. And you spend a day learning about dental assisting and dental hygiene. You actually do hands-on activities. You'll have the opportunity to do instrument transfer, take impressions, place Pitt and Fisher sealants, obviously on mannequins. But it's a great day to learn more about dental assisting and dental hygiene. So what does the dental assistant do? Well, they do a lot of things. They do so many things. But the purpose of a dental assistant is to increase the efficiency of the dentist working chairside so they can provide better quality patient care to that patient. And the reason that can happen is the dental assistant is sitting right next to the dentist. So on this diagram, the dentist is on the left and the dental assistant is on the right, and the patient is centered in the middle. So that dental assistant will transfer over all the materials, all the instruments that that dentist will need during the delivery of dental care. So when you look at a job description, it is very comprehensive, and it depends on which practice you work in. You're going to have different responsibilities in an orthodontic practice than you would in an endodontic practice versus an oral surgery practice versus a general practice. So that comprehensive responsibilities does vary, and it varies from practice to practice, and it can vary from day to day in the same practice. But the bottom line is you have to have interpersonal skills, and you have to have technical skills. The one big thing is you need to be a people person. You need to like people. You need to want to work with people. You need to be friendly. You have to be friendly to patients. You have to work with your co-workers under sometimes stressful situations. So you have to be able to communicate. You have to be able to work with your hands, have dexterity, and you need to want to take on additional responsibility and take pride in your end product. And if you like to learn every day, learn something new, dental assisting may be for you. So that interaction with people, because you're going to talk to the front desk person, you're going to talk to the patient, the dentist, you're going to have people that come in to sell products, you're going to go to continuing education classes where you have to communicate with individuals. So you have to talk to a variety of people. So to name some of the few things, we have it down here for you. And you can look and see it's a variety, a great variety of things that you do as a dental assistant with teaching, and you take impressions, and you have to learn to communicate with individuals chairside. You have to be able to take radiographs, impressions. You work the front desk. You're going to be responsible for sterilization and infection control. So there is just a variety of things that you do on a daily basis. So you wear many hats. Okay, one thing you need to be is organized. You have to be very organized to work as a dental assistant, but at the same time, you can't be so organized that you can't change up, because you might have 1, 2, 3, 4 that you think is going to happen, and 4 becomes 2 and 2 becomes 3, and you have to be able to go with the flow to be a good dental assistant. So here are some of the career advantages. Number one, you have a lot of variety. Things change. You can change in your career. You could work for an endodontist for 2 years, and then you could go work for an orthodontist for 2 years. You can work for a general practitioner, then go to an orthodontic office. You have a lot of flexibility. Some offices allow you to work full-time, or they'll ask you to work part-time. So you have that possibility. And then you have excellent working conditions. We'll be showing you some of the facilities that you can work in. And then you have personal satisfaction, because on every day that you go to work, you help somebody. And that makes you have personal pride in what you do on a daily basis. So one of the things that our students in the past have been attracted to is they said, hey, I like to have a 3-day weekend every single weekend. And a lot of offices do operate Monday through Thursday, 8 to 5. Then you're off Friday, Saturday, and Sunday. And that's every week. Now, this is changing. Some offices are opening now on Fridays, and sometimes Saturdays, and sometimes Sundays. So there is a possibility to work on weekends if that works better for your personal schedule, or evenings. Some offices are opening in evenings also. So where can you work as a dental assistant? Well, most offices that our students get a job in, or a lot of them, I should say, are solo practices. They're owned by one dentist, okay? And then they employ X number of people underneath them working for them. You could work for a group practice where more than one dentist owns the practice. And you also can work in public health dentistry, such as a health department. We have a health department here in Wake County that has a dental clinic. Our students actually rotate through that facility during their clinical rotations. You can work at a hospital dental clinic. Our students also rotate through the hospital dental clinic at UNC Chapel Hill. You can work at a dental school. We have graduates that work at UNC Chapel Hill, and there is also a dental school at East Carolina University. And then you can work in specialty practices, such as ortho, endo, perio, pros, pediatric dentistry. So you can work in private practice specialties. So this is where you'd go to work. You get up, you go to work, you go into what we call the clinical side. Some people refer to it as the back. And this would be the environment that you'll sit chairside with the dentist and provide patient care. This is just showing another office that has more of that bay concept, where this might be a pediatric practice or an orthodontic practice. Obviously has an ACC theme. So what we want to kind of challenge you to do is just get in your car, take a walk. If you look at the next slide, you'll see that you can see new practices opening up all over this area. This one has, now open. So you literally can walk around and say, hey, I'd like to work there. And how do I become employed there? And our program is the answer to that. If you graduate from our program, you can work for a few years as a dental assistant and say, hey, I want to do something else. And there's some opportunities for you to do that. You can go into education. I'll bring that up because I have 3 of the graduates from a program several years ago that are now actually faculty members within the program. You could also work for an insurance company, and you could work as a dental sales rep. So there are possibilities to career ladder after you've been in the field of dental assisting for a few years. So everybody wants to know what the salary is. And we look at a national salary. The Dental Assisting National Board publishes a salary about every 2 years for people who report their salaries, and they do a survey. And it ranges between $18 to $19 per hour if you're a dental assistant that's not a certified dental assistant. But if you look at their statistics, if you're a certified dental assistant, you usually make about $2 more per hour. So that's going to be the $20 to $21 hour range. And that's pretty true for our graduates in this area. So an annual salary for 32 work hours a week is approximately, according to the Bureau of Labor Statistics, $40,000. Now you literally can go to this link, and I have another slide later on about it, and you can click it and click North Carolina, then click Wake County, and you can even click Cary, North Carolina to find out what the salary is for dental assistants in this area. So dental assisting is a fast-growing profession. It's in high demand. Our graduates are, as soon as they graduate, they're employed. They're projecting a 7% increase all the way to 2029. That's on the national level. And actually, this statistic was published in 2019. I bet this has gone up since COVID because some people didn't return back. They were ready to retire, and they're like, okay, everything kind of shut down with COVID. They didn't return back to the workforce. So I would imagine for the next few years, it'll be even higher than 7%. If you want to know what's the job opportunities in this area, go to Google, look up Indeed.com, ZipRecruiter, any one of them that you look at will show you there's lots of jobs out there on the market, and you could be employed after 1 year in our program. I picked a job advertisement just to kind of show you and I bolded in there, it says must be a DA2 or CDA. And so you'll see that if you're looking at jobs, you think, what's a DA2? Well, DA2 is a status of recognition by the State Board of Dental Examiners. And our students, when they graduate from our program, because it is an accredited program through the American Dental Association, the Commission on Dental Accreditation, because it is accredited, you're automatically a DA2 when you complete the program. And we encourage all of our students to challenge the Dental Assisting National Board. We typically have a 100% pass rate, and then you will be a certified dental assistant. So almost any job advertisement that you see out there as a graduate of our program, you're going to meet those requirements. You'll be able to coronal polish, take x-rays. You'll have the DA2 status. You can become a CDA. You're going to have expanded functions. You're going to be tested on those and evaluated on those. You'll be CPR certified. You're going to have extensive infection control training. And like I said, you have 384 clinical hours. So clinical experience will be under your belt. So when you see those job advertisements and you're looking at what are they looking for, we've listed some of these here for you, and you will have all of those, every single one of those as a graduate of our program. So we put a couple slides in here to, because when you say, well, coronal polishing, what does that mean? That means you legally can polish someone's teeth, okay? And you've had this done. If you've ever had your teeth cleaned, the hygienist or they bring a dental assistant in to coronal polish. So that's something you will be eligible to do as a graduate of our program. You'll also be able to take impressions. They're called DA2 functions or expanded functions. So you'll be able to take impressions. You'll be able to do X-rays, that's what most people call them. We call it digital images. So you'll be able to take digital images upon graduation from our program. You'll be able to place Pitt and Fisher sealants. Some of you may have had Pitt and Fisher sealants placed. So legally, as a dental assistant that has graduated from our program, you will be able to perform that function. You'll be able to take vital signs. And when you graduate, we can almost guarantee you employment because our students, 2 months after graduation, when we track them, they're employed. And usually it's within 1 month, and 50% or more of the students are actually employed before they ever graduate because they do clinical rotations in the summer. And when they excel, the dentist will hire them if they have a need in their office. And if they don't have a need in their office, they'll tell someone about that student. Say, hey, if you need somebody, you need to hire this person because they're doing such a good job. So this is that slide I was telling you about that you could go to the Bureau of Labor and Statistics. So you can go back and watch this video again and again. I think it's going to be on Friday uploaded and everybody can view it. So you can go back and watch it again. But this tells you how you can get that information about salaries. So why should you select Wake Tech's dental assisting program? There's a lot of dental assisting programs advertised in this area. What you need to look at, personally, the way I feel, is you need to look to see if you are selecting a program that is accredited by the American Dental Association. And that's accredited through the Commission on Dental Accreditation. And what that means, you're recognized when you graduate from that program. You're recognized as a DA2 by the North Carolina State Board of Dental Examiners. So all those things that you need to be able to do to get employed, you will be able to perform legally. So that's, to me, that's the main thing to look at. And we are the only accredited program that is located within a community college in this area. Now you're going to see other dental assisting programs, but when they finish those programs, they're classified as a DA1 and not a DA2. We've been here 30 years, okay? So we have built an excellent reputation in this community. People want to hire Wake Tech graduates. One of the reasons is because we are accredited. I think one of the reasons is because we have an excellent faculty. All of our faculty are certified dental assistants or registered dental hygienists. They have clinical experience. They have educational experience. And they're here to provide the best educational opportunity for our students. We have over 80 affiliation sites or places that you can rotate through, and we're in some of the top-notch practices in Wake County and other counties surrounding. And then in 2019, we moved into a state-of-the-art clinical facility. We'll show you a couple slides about that. It is absolutely beautiful. And then we have a separate Sims lab where each student is assigned their own mannequin, like their own little body, and they are assigned that for 2 semesters, and then they work on that pretend patient for the time that they're in labs. So this is a picture of our clinic that we moved into. It has 8 treatment rooms. It's state-of-the-art. This is our sterilization area. Red is contaminated, transferring down to blue, being sterile. And we always start you off on mannequins. You learn to take x-rays or digital images on mannequins. You actually purchase a typodont. That's what this individual is working on. And you can see it here also in this picture. And then you can work on the typodont in the lab, and then you can take it home and continue to work and learn. After you finish working on mannequins and you get checked off, then we have you do peer patient activities. So you take impressions on each other. You place rubber dams on each other. So we get you ready for your actual real patients, which start in the spring semester and continue on through July. And then you provide patient treatment to actual patients. Now, you can't be bothered by some things to be in dental assisting, like blood can't bother you, or calculus, or splatter, or pus, or exudate, certain smells. You can't be afraid of needles, and you also certain sounds you can't be afraid of because you're going to experience those on a daily basis. So pus, you know, if you're going to have somebody that has some type of pus, it opens up, it may have a smell to it. You're going to see blood. There's no doubt you're going to see blood, so you need to be aware of that. And you're going to assemble and disassemble needles, and you're going to be there when the anesthetic is being delivered to the patient. You have to comfort the patient, so you can't be afraid of needles. And we get you ready. Okay, we're going to make sure that you work safely. We do a lot of training on how to use personal protective equipment. We train you on how to read safety data sheets so you're safe to work with certain chemicals. And we have set standard operating procedures so you learn how to do things in sequential order so you can always work safely. So this could be you. I mean, a year from now, if you get accepted this May or even the next May, 1 year from now, well, actually you'll be chairside, you know, after one semester in the program, but you will be sitting there working with a dentist. You're going to learn a lot of things in the dental assisting program. You're going to learn in one course, you learn tooth numbers and surfaces and nerves and muscles. You kind of learn a new language within about 6 weeks in the program, because we'll say mesial and facial and lingual and buccal, and you'll just know what those terms mean. You'll learn over 800 instruments in the fall semester. You have to learn the name of them, what they're used for, so you can identify those on your clinicals. So there's a process for the admission into the dental assisting program or any one of the programs in the Perry Health Sciences campus. And when you go to our website, it will show you that. The first thing is related to Wake Tech, the North Carolina Residency Determination Interview. So you have to go through that process. And then you'll do step by step by step. But the one thing that you have to do is you must take a mandatory information or go to a mandatory information course. Now, they're only being offered virtually now. They're not being offered on campus. But you go to the website, you can click and sign up to take that mandatory information session. So it's a process. You apply, you activate, you complete. And when you go through all those steps, then you can be in the process of applying for our program. Remember, it's mandatory you take an information session. And this is very important because you get a lot more information that we're able to provide you in this short period of time. So if you are interested, we're going to leave the slide up just for a few seconds in case you want to jot down Toy Griffin Nelson's name and email address. She is our admissions counselor. And so she's the contact person, and she's the one that knows everything. She's the one that's going to tell you all the information during the mandatory information sessions. So she is the contact person. Now, we'll be glad to answer any questions, but we really don't even know who our students are until after she ranks them and tells us the names. So we're not involved at all in the admissions process. Okay, so it is competitive admission. Some people say, oh, don't go to the dental assisting program at Wake Tech. They have a waiting list. That's not true. There is no waiting list. I want to make sure that that's clear. But what we do is, because we only have 32 slots and we have a lot of people apply, we have a ranking system of how you accumulate competitive admission points. So we'll kind of take a look at this. We'll take one of the Gen Ed courses. There's 4 of them, but we'll take one of them. They're all 3 credit hours. So if you take English 111 and you make an A in it, they'll multiply that 3 credit hour course by 4. If you make a B, they'll multiply it times 3. And if you make a C, they'll multiply it times 2. So you can either earn 12, 9, or 6 points. So obviously, the higher the grade you make, the greater chance you have of earning the most competitive admission points. So you would do that for all 4 courses, and they're listed here for you. Now, Bio 106, if you notice, is doubled. So when you earn that 12 points with an A, they will double those points. So you can earn up to 24 points in your bio course. So from your Gen Eds, you can earn up to 60 points. All right, and then we want to make sure everybody knows that a student that's coming into the dental assisting program will be required to have a criminal background check. And that's because our clinical rotation sites require it. So if you were flagged in your criminal background check, that is sent over to the clinical sites. They review it and they make the decision if you can rotate there. And if the decision is no, then that could impede you, it will impede you from being able to complete the program, because you would not be able to do clinical rotations. More information about that is also on the website. We do not do drug testing at this point in time. Some of the other programs do have random drug testing because their clinical sites require it, but we always tell applicants this could be a requirement in the future for any one of our clinical sites. So you could get into the program in May, start in August, and before we start clinicals in January, if our clinical site said yes, they're going to have mandatory drug testing, you would be required to do that. So we always let people know. Now, you have to be ready because when you're working clinically, you could stick yourself with a contaminated needle or a blade or a suture needle or orthodontic wire. I mean, it could happen. And that's called an occupational exposure. You actually could be splashed. And if you were not wearing your PPE correctly, you could have an occupational exposure. So to prevent that, we teach you how to wear your PPE correctly. And we do a lot of training on how to handle sharps safely so you don't have that exposure incident. 2 courses after you complete your 4 gen ed courses and you're in that pipeline for becoming a dental assisting candidate, you can take, before you're accepted into the program, 2 dental assisting courses. Den 111, which is an infection hazard control course. You can take that in advance and you actually can earn more points towards the competitive admission process. And you can also take Den 100. And that also, it enables you to earn additional points for the competitive admission process. You do not have to take them before you get into the program, but we have found it beneficial because the students are able to stay interested in the dental field. We have a website. All the information that was presented tonight and more is on the website. This is the actual building our clinical facility is located in. We are on the Perry Health Sciences campus, right near Wake Med Hospital, Wake County Human Services, off of New Bern Avenue, Sunnybrook, Holston. That's where we're located. And we're on the 3rd floor. She's moving the mouse there for you. We have 1/2 of the 3rd floor. That's where our 8 treatment room facility is located. Okay, so personally, I feel dental assisting is challenging, but what I like about it is lots of fun on a day-to-day basis, and it's really never boring. So if you're thinking about a career that you like people, you like hands-on, and you like challenges, dental assisting may be for you.
Thank you, Ms. Clark. We have
You're
several
welcome.
questions that came in during the presentation. I'm going to turn it over to Ms. Trudy Clark and Ms. Cindy Daniels to address these for our audience. Please feel free to submit additional questions and we will do our best to answer them before the end of the session. So I am going to start with the first question. Can I take classes at night?
The dental assisting program, when you get into the program and you're taking the DEN courses, like DEN 100, DEN 111, those are only offered in the daytime between 8 and 5. Now, your gen ed courses, they do offer those sometimes online or even when we get back to campus, which is hopefully in the fall, looks like it's going to be in the fall, some of those are offered in the evening. But when you're in the program, your curriculum will be 8 to 5, Monday through Friday.
Can I work full-time or part-time while in the program?
It is recommended not to work. Okay, now we know that's usually not possible for a lot of our students. So we tell them if you could work 10 hours or less and try to work on the weekends because it is a rigorous curriculum, requires a lot of studying to be successful. So if it's possible not to work, that's the best scenario. But if you do have to work, try to work 10 hours or less. And if you know you're getting into the program, work as many hours as you can before you get in and save up a little nest egg that you can use.
What courses do I need to take for the competitive admissions process to earn points?
The 4 courses that you need to take are Bio 106, English 111, Com 120, and you can take Psych 118 or Psych 150. Both of those will meet the curriculum requirements.
All right, Miss Cindy Daniels is going to ask some questions.
If anybody has any questions, you can put them in the chat and we'll try to answer those also.
Okay, where will students do clinical rotations?
Clinical rotations in the spring semester are at the Adams School of Dentistry, which is in Chapel Hill, North Carolina. So the students are assigned there. They rotate through endo, ortho, oral surgery, office, special care, geriatric, sterilization, grad operative. I think I named them all. So they rotate through different clinical areas. while at the Adams School of Dentistry. While in Chapel Hill, they also receive a rotation at the hospital dental clinic. And then if they're not in Chapel Hill and they're scheduled in Raleigh, North Carolina, they'll go to Wake County Human Services Dental Clinic and or Wake Smiles Dental Clinic here in Raleigh, North Carolina. Then in the summer, they go out to private practices, and that could be, we have 80 affiliation sites. So it's different private practices throughout the area.
Where can I work after graduation?
After you graduate from the program, you can choose to work in private practice. And a lot of our graduates do work in private practice. You could work for one dentist, a solo practice, or a group practice. You can work for a general dentist, or you can work for a specialist. Like you may say, I want to work for an orthodontist or an endodontist or an oral surgeon. So the private practice sector does employ most of our graduates. You can work for Wake County Human Services Dental Clinic, which is more of a governmental type setting. You can work for the prison system. They have dental clinics there. You can work for universities within dental schools like UNC or ECU. So those are some of the options of places that you can work upon graduation.
What will be my starting salary?
Well, it varies, and it even varies in Wake County. It depends on the practice, but it's going to range between $18 per hour to $22 per hour. And that's based on our statistics, not just at a national statistic level. But our graduates, when they report to us, that's the range that they are receiving in this area. Some offices may not pay as much per hour, but they have a bigger benefit package that goes along with it. Some of the offices that may pay more per hour may not have as many of the benefits. So you have to kind of figure out what you need to satisfy your employment needs. Like, do you need to have health insurance, or do you need to have 3 weeks of vacation, or do you need, what are your needs? So you have to kind of match that up with what is out there, what opportunities are out there.
Great. Do I have to complete dental assisting school to get into dental hygiene school?
You do not. I do not know of any program in the state of North Carolina that requires that. I know some states do have that, but in North Carolina, that is not a requirement. And actually, some programs do not even give you competitive admission points if you have completed a dental assisting program. Some dental hygiene programs do. So you have to look at the hygiene requirements, but it is not mandatory in the state of North Carolina for you to finish a dental assisting program to go into dental hygiene. We've had a lot of graduates that have done exactly that. They were in dental assisting, they either went directly into dental hygiene, or they worked for a few years as a dental assistant and then returned to school and became a dental hygienist. So it's a great preparation for dental hygiene school, obviously, but it is not a requirement.
How many students get jobs after graduation from the dental assisting program?
As many as we graduate. Okay, so we accept 32, and we usually lose a few students for various reasons. But last year we graduated 29 students out of the 32 we accepted, and they all are still employed. I think one is at home with her young child, and one went directly, no, maybe, I think just one is at home with her child. So it's a 100% placement rate. If you graduate, we can almost guarantee you'll get a job.
How much will it cost me to complete the program?
That changes obviously from year to year because of expenses, but we do have that on our website. It's approximately $8,000. So we include everything in that. I mean, uniforms, books, registration fees. We even estimate the gas that you're going to need to go to your clinical sites. So it's around $8,000.
Do I have to attend an information session for the admission process?
That is mandatory. And if you go to the website, you'll see the various sessions that are offered that you can sign up for. So that is mandatory. And when we go back to how much does it cost to get into the program, You also need to look at financial aid, and that's a whole separate entity. We don't get involved in that, but financial aid is available. And you'll find out when you get into the program, we also have various scholarships that students can apply for.
Alrighty, that was all of our questions for tonight. There were no more Q&A questions. So I want to thank you for joining our virtual open house. We hope that you will explore the other sessions offered this week, and you can do so by visiting openhouse.waketech.edu. We look forward to seeing you at Wake Tech. I hope everyone has a great night. Thank you, Ms. Clark. Thank you, Cindy.
Thank you. Good night.
Thank
Check
you.
Check out
Good
Dental
night.
Assisting. Good night.